How can I help my dark, hollow, puffy eyes? People always ask if I'm tired. Can I look more awake? What do you suggest to make this happen? Cost is a concern, so I specifically worry about the lower eye. Will I get results?
Thank you for your question. You stated in your question that people are always asking you why you're tired. And certainly with the photos you submitted, it's understandable when you look just at your eyes. The eyes communicate so much about your mood, whether it's intentional or not. And unconsciously, bags under the eyes always convey a feeling of fatigue, age, just nothing good comes from having bags under the eyes. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And probably the most common thing we deal with are under eye bags. And the reason is it transcends age, gender, ethnicity. You can be as young as 14 and people well into their 80s and over will have under eye bags. So you're in very good company. The most common thing people say to me is they're frustrated that their friends or family keep asking them, what's the matter? Are you tired? So understanding what is causing the under eye bags is critical to then deciding what you should do. The under eye bags are represented by something because they occur because of something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around the eyes pushes forward and creates a bulge. And that bulge doesn't go away no matter how much sleep you get, no matter how many over-the-counter creams, which is very common for people to do first. They go to the store and they find every cream that is meant to treat dark circles and under eye bags, and no matter how many they try, they keep trying, and they always find that they don't work, they don't do anything, because they can't deal, the creams can't do anything for a physical volume pushing forward and creating this bulge. So the procedure that is generally recommended for under eye fat pockets that are continuous as yours are is something called a lower eyelid blepharoplasty. Now there are two ways of doing lower eyelid blepharoplasty, and it depends on your physical exam on which approach is ideal for you. There's the transcutaneous approach, which is an external incision made below the eyelashes, and then there's the transconjunctival approach from the inside of the eyelid. We commonly perform the transconjunctival approach for its many advantages, including avoidance of an external incision scar, as well as the preservation of the muscle and function of the lower eyelid. We often combine these procedures with skin tightening procedures, such as the use of fractional CO2 laser and thermal devices such as Convey, as well as the use of something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it has the concentrated growth factors and healing cells that are associated with wound healing, and it's had a very beneficial effect on the skin quality. So as much as you may not like the idea and you may be concerned about cost, it's very important that you do the right thing. A lot of people try to take shortcuts either by trying to do procedures that don't really work. A common one is using non-surgical heating devices. It doesn't matter what the brand name is, they just don't do the job. And two is to try to find cheap surgery. Those are bad decisions. As a specialist, I fix a lot, or I should say I restore or revise a lot of, quote, cheap surgeries when people try to save money. There's always a simple reality. You never get something cheap when there's a higher value that someone else is charging who is likely to do a better job. There's intrinsically costs to doing everything we do, but that's, I'm diverging from the original question. Essentially, we're looking to restore a a contour and a shape that makes the eyes look as if you never had the bags. So my recommendation is to meet with the qualified and experienced cosmetic surgeons so that you can feel comfortable with who you're going to move forward with. If cost is an issue, then wait. Spend the right amount of money in the right time to do the best job that's right for you. Meet with a cosmetic surgeon who you'll be comfortable with. We've had many patients who came to us and said, okay, now I know what I want to do. And before you know it, a year goes by and they've saved their money and they're ready to do it, and they move forward and they're happy with the investment. Think of it as an investment and not just as a transaction. It's not something that is easy to undo. So meet with doctors, find someone you feel comfortable with, invest the right amount of money that is appropriate, and I'm sure you'll feel very good about the results. Lower eyelid surgery is one of the most satisfying things that people experience, and we get so much positive feedback about. If there's one thing someone's going to do in their life for their face, it will be their eyes. And under eye bags can have almost treatment of the under eye bags can have almost a facelifting result, because it just brightens up the whole face. So I hope that was helpful. I wish you the best of luck, and thank you for your question.